Assalamualaikum and hi everyone. So today our group M1 will be presenting subtopic 14.4 health issues related to human musculoskeletal system. The function of musculoskeletal system may be affected by disorders. What kind of disorders? Osteoporosis, scoliosis, osteomalacia, arthritis, and many more types of bone disorders. But for today, we will be discussing about this type of bone disorders. So let us proceed to osteoporosis. Osteoporosis is a type of bone disorder which the characteristic is weak bones that break easily. How does it happen? So osteoporosis happens when the rate of calcium loss is higher compared to the rate of calcium absorption. It is because lack of exercise too, and low intake of calcium, phosphorus, vitamin D. Commonly, who have osteoporosis? Commonly, osteoporosis occurs among women who reach menopause due to decreasing of their estrogen level. Why it involve estrogen? Estrogen involved in calcium metabolism, which helps the body to absorb calcium and reduces calcium loss from the bone. So what happens if the estrogen level decrease? It can reduce bone density due to the loss of calcium from bones. So as we know, estrogen helps the body to absorb calcium and reduce calcium loss from the bone. So if the estrogen level decrease, the absorption of calcium will be low. Okay, what are osteoporosis symptoms? First, stoop postures, fragile bones, and it can reduce height too, due to the lack of calcium in bones. So that's the end for osteoporosis. Let us proceed to osteomalacia. Osteomalacia is a soft bone condition. So how osteomalacia happens? It is because low intake of calcium, phosphorus, vitamin D. And if we take drugs too, it can also cause osteomalacia. And lastly, inadequate sun exposures also can cause osteomalacia. So commonly, who have osteomalacia? Osteomalacia commonly occurs among adults, especially pregnant women. It is also occurs among children, but it is called rickets. Okay, what happens if the children have rickets? It can cause the softening and weakening their bones. So, what is the difference between osteomalacia and rickets? So, basically, osteomalacia happen due to impaired mineralization of osteoid, while rickets happen due to impaired mineralization of cartilaginous growth plate. Adults have fused their growth plate with their bones. Meanwhile, children still have their growth plate, which can lead to rickets. So, what are osteomalacia symptoms? Pain in bones and hips, muscle weakness, bone fractures, and difficulty in walking. So how to prevent osteomalacia? Yes, we can prevent it. So eat food high in vitamin D and take supplements if needed.
Assalamualaikum and good afternoon. My name is Muhammad Izul Hakimi from Formatera, and I will be continuing the presentation about health issues of the human musculoskeletal system. So, the next health issue is arthritis. Arthritis is the inflammation of a joint, causing it to deteriorate. There are two types of arthritis. The first one is osteoarthritis, which is the most common type. The second is rheumatoid arthritis. Arthritis is more common in adults over 65 years old and is more common in women compared to men. Being overweight also increases the risk of getting arthritis. So, the comparison between osteoarthritis and rheumatoid arthritis. So first, osteoarthritis first. Osteoarthritis is caused by decreased synovial fluid and wear and tear in certain joints. This reduces the amount of pressure the cartilage can withstand. If you don't know, the cartilage function is to withstand pressure to protect our tissues. When the amount of pressure that can be withstood by the cartilage decreases, this causes our tissue to be damaged, specifically joints. You have a higher risk of getting osteoarthritis if your family had a history with the disease, such as your mother previously having osteoarthritis. The second one, rheumatoid arthritis, is an autoimmune disorder where your immune system attacks tissues of your body. This causes the synovial tissue that secretes fluid, specifically synovial fluid, to be attacked, which also causes the amount of pressure the cartilage can withstand to reduce. Rheumatoid arthritis can cause the bones and cartilage inside the joint to be destroyed if left unchecked. So, the symptoms of arthritis include joint pain, swelling, and stiffness of joints, reduction of your range of motion, which is the direction and distance of a joint's ability to move. This will cause you have difficulty in moving, even when walking only. Next is the redness of skin around the joint affected. People have noted that the symptoms are worse in the morning compared to other times of the day. For rheumatoid arthritis, there are additional symptoms, such as loss of appetite and feel tired due to the immune system attacking your body. Anemic, which is your red blood cells amount decreases. And lastly, you will feel slight fever. Arthritis currently has no cure, but there are ways to treat arthritis. The main goal is to reduce the pain by using things such as heating pads and ice packs, using mobility assistance devices such as cans. This will reduce the amount of pressure at joints. Medications such as menthol or capsaicin creams to block pain signals transmitted from joints. Surgery to replace affected joints with artificial joints, and physical therapy such as exercising. The next health issue is scoliosis. Scoliosis is an abnormal curvature of the spine. The patient's spine is bent to the side and forms an S or C shape. It is commonly caused by birth defects, neurological abnormalities, or abnormal growth of the spine during puberty. Idiopathic scoliosis is most common, where there is no definite cause. Scoliosis affects infants 0 to 3 years old, juveniles 4 to 10 years old, adolescents 10 to 18 years old, and adults above 18 years old, where adolescents are found to be most affected. So there are two types of scoliosis. The first one is congenital, which is spinal deformities are apparent from birth, which means you can observe the spinal problems of a person when they are born. The second one is neurological, where nerve abnormalities affect muscles near the spine, causing scoliosis itself. The symptoms of scoliosis include one shoulder blade higher and sticks out more, which means you will have an uneven shoulder height, such as one shoulder being higher than the other. Uneven hips, rotating spine, which forms an S or C shape, back pains, and breathing problems caused by reduced area in the chest for lungs to expand. Like arthritis, there are no cure for scoliosis, but there are ways to treat. The first way is bracing. Bracing is for people who are still going and the spine curve is between 25 degrees to 40 degrees. The bracing does not cure scoliosis itself, but prevents any further spine from curving. It prevents the spine from curving even further. Doctors advise people to use the brace for 16 to 23 hours a day. The more you use, the more effective it is. However, people will stop using braces when they stop growing or reach adolescence. The second treatment is surgery, or more specifically, spinal fusion. This is for people who have a spine curvature over 40 degrees that disrupts their daily life. The spinal fusion will fuse your spine with a bone graft, rods, and screw that helps the spine maintain a straight shape. The spine will eventually merge with the bone graft and becomes a single bone. However, as impressive as this sounds, spinal fusion has its drawbacks, such as infection, pain, nerve damage, failure to heal, and excessive bleeding.
Assalamualaikum warahmatullahi wabarakatuh. So now, I will proceed to the practices to maintain a healthy musculoskeletal system. A well-functioning musculoskeletal system allows us to carry out our daily activities without any problems. So, we need to practice the following to maintain the health of the musculoskeletal system. By doing some of these practices, we can prevent ourselves from getting health issues related to the human musculoskeletal system. So let's proceed. The first practices that we can do is to maintain a good body posture. A good body posture refers to a person's body position when sitting, lying, walking, and standing. We should not slouch while standing or sitting. It is because slouching will exert pressure on the vertebral column that will resulting in the misalignment of the vertebral column. So, by doing this good body posture, we can prevent circulation of the blood, suppressing nerves and vital organs. Sorry for the typo. Okay, so this is the example of good body posture. On the left picture, it shows that a good and bad posture while we are standing, while on the right picture, it shows that a good and bad posture while we are lying. On the left picture, it shows that the good and bad body posture while we were playing our smartphones, while on the right picture it shows the good body posture while we were sitting. So by doing this 4 body posture, we can prevent ourselves from getting any musculoskeletal system disease. So the next practice is wearing a proper attire. Wearing a proper, comfortable and loose clothing so as not to restrict blood circulation and affect musculoskeletal system. Suitable low heel and cushion shoes are important in providing support and preventing injury to vertebral column and ankle sprain, while high heel shoes put pressure on the leg bones and vertebral column and may cause injury. So, it is better for us to wear a low heel and cushion shoes. So this is the example of proper attire. On the left picture, it shows the proper attire while we are walking, while the right picture shows us the proper attire while we were jogging or doing some sport activities.
So, the next practices to maintain a healthy musculoskeletal system is exercise. Exercises can help to strengthen the joint structure and increase the flexibility of muscles and ligaments. Apart from that, it also increased our bone strength and bone mineral deposits among adults, as well as preventing adults from getting osteoporosis in the elderly. Lastly is balanced diet. So we need to consume a balanced diet, especially foods enrich calcium in milk, minerals like phosphate, and vitamin C and D. So, calcium helps to strengthen our bone, while vitamin D aids in calcium absorption and vitamin C increases the bone mass. Last but not least is the effects of our daily practices on the musculoskeletal muscles. So, firstly is what is the effect of wearing high-heeled shoes? Wearing high-heeled shoes can lead to alignment issues that damage your back ligaments, joints, and vertebral disc. And wearing high heels can cause our tendons to thicken and the calf muscles to shorten. Secondly is what is the effect of sitting with your wallet in your back pocket? So, sitting on your wallet can cause a pain in hip and even leg. Sitting on wallet will also pinch your sciatic nerve and also cause your pelvis and spine to position in a way that isn't natural or straight. When the sciatic nerve is triggered, this will cause pain on the lower back, through hips and buttocks, and down each leg. As you can see in the diagram, it shows that the position when we are sitting on our wallet. Thirdly, what is the effect of carrying a heavy bag? So, when we are carrying a heavy bag, it will cause us to feel neck and back pain, shoulder strain, and fatigue. While carrying bag on one shoulder will cause uneven weight distribution. When people are carrying a heavy bag, they tend to bend down too much and they will look a little short. This will affect our body posture and in addition can lead to inflammation causing shoulder tendonitis. So based on the diagram, we can see the result of carrying your bag on one shoulder. Lastly, what is the effect of incorrect body posture when using smartphone? As we know, we use our smartphone almost every day in our daily life. But if we use the incorrect body posture, what is the effect of it? So, when using our smartphone, people usually bend down too much and too long. So, this will cause back, shoulder, and neck pain. And lastly, it will cause us to experience difficulty in breathing and headache. So, in order for us to not feel this way, we can sit straight when looking at our phone, so we won't experience this pain. So that's all from us. Thank you.